Most people think cholesterol is the most important number on a blood test when it comes to heart disease. LDL, HDL, triglycerides. We've heard those words for decades, but here's what most people don't realize. There's another number hiding on some blood tests that can quietly increase your risk of heart attack, stroke, blocked arteries, and even dementia, even when your cholesterol looks normal. And the truly frustrating part? Millions of people have never even been tested for it. I'm Dr. Amelia Carter, and today we're talking about lipoprotein A, also called LPA. Tiny little name, massive consequences. And if you're over 60, this is one conversation you absolutely need to hear. Because I've had patients walk into my office with beautiful cholesterol numbers their doctor praised for years, and yet they still ended up needing stents, bypass surgery, or suffered a stroke seemingly out of nowhere. Why? Stay with me, because by the end of this video, you're going to understand what LPA actually is, why it can be more dangerous than regular cholesterol, who should get tested, what symptoms people often ignore, and most importantly, what you can actually do about it starting today. And trust me, this is the part nobody talks about. Now, before we dive in, I want to hear from you. Have you ever had normal blood work but still felt worried about your heart health? Comment yes below if that's happened to you. And if you already know your LPA number, type it in the comments. I read these comments every evening with a cup of tea and my very judgmental cat, Winston, who believes he's medically qualified. And give this video a thumbs up. It really helps us reach more seniors who may have absolutely no idea this number exists. Now let's talk about what LPA actually is. Think of your bloodstream like a highway system. Your cholesterol particles are delivery trucks carrying fat and cholesterol through your body. Some trucks are helpful, some are troublemakers. LDL cholesterol is the one we usually worry about because it can dump cholesterol into artery walls. But LPA? LPA is like LDL cholesterol wearing a disguise and carrying a box of razor blades in the trunk. It's especially sticky, especially inflammatory, and especially good at helping plaque build inside arteries. Worse, it can interfere with your body's ability to dissolve blood clots properly. So now you've got two problems: more plaque formation and potentially more dangerous clotting. That combination is like pouring grease into plumbing pipes while also making it harder to clear the blockage. And here's the truly important part. For most people, LPA is inherited, meaning you can eat salads until you turn green, walk 5 miles a day, and still have high LPA. You did not cause this. That's why so many healthy-looking people get blindsided. In fact, let me tell you about one of my patients. Her name was Linda, 72 years old, retired school teacher, sharp as a tack, organized every spice alphabetically in her kitchen. Honestly, terrifyingly organized. Linda exercised regularly, never smoked, barely drank. Her cholesterol numbers looked decent. Her LDL wasn't perfect, but nothing dramatic. And for years, every doctor told her the same thing: "You're doing great." Then one morning, she developed pressure in her chest while gardening. Not severe pain, just pressure. She thought maybe she pulled a muscle reaching for a flower pot. Her husband wanted to call 911. She said, "Oh, stop fussing over me." Classic Linda, but the discomfort kept returning, especially when walking uphill. Finally, she came to see me. We did additional testing, including LPA. Her result? Extremely elevated. And when we looked deeper, we found significant plaque buildup in multiple coronary arteries. Linda looked at me and said something I'll never forget. "But how could this happen? I did everything right." That question breaks my heart every single time. Because many people think heart disease only happens to people with terrible lifestyles. But biology is more complicated than that. Genes matter, inflammation matters, hidden risk factors matter. The good news is, Linda caught it before a catastrophic heart attack happened. We aggressively managed her risk factors, adjusted medications, improved exercise strategy, tightened blood pressure control, changed her nutrition plan, and monitored her carefully. Today she's doing beautifully. But here's the lesson. Normal cholesterol does not always mean low risk. And this next part is critical. There are several signs and clues that should make you ask your doctor about LPA. Sign number 1, a strong family history of heart disease. This is the biggest clue. Did your father have a heart attack in his 50s? Did your mother have a stroke unexpectedly? Did a sibling need bypass surgery despite being healthy? That matters. You might be thinking, well, doc, my whole family had heart problems. We just assumed it was age. Maybe, but maybe not. LPA tends to run in families like eye color or height. I sometimes explain it this way. Imagine every generation passes down an old recipe box, except instead of cookie recipes, somebody slipped in a dangerous instruction manual for artery disease, and nobody realizes it's there until problems begin appearing across generations. My recommendation? If you have a family history of early heart disease, ask for an LPA test at least once in your life. One simple blood test. That's it. Sign number 2, heart disease despite healthy habits. This one confuses people. I hear it constantly. Doc, I exercise. I eat healthy. I'm not overweight. I don't smoke. And yet arteries are still narrowing. Why? Because LPA doesn't always care how virtuous you are. Now, don't misunderstand me. Lifestyle absolutely matters. It matters enormously. Healthy habits reduce overall risk dramatically. But high LPA is like driving through a snowstorm with excellent tires. The tires help, but conditions are still dangerous. That's why people with elevated LPA often need more aggressive prevention strategies. And here's what most people don't realize. Two people can have the exact same LDL cholesterol number, but the one with high LPA may have much higher cardiovascular risk. That's why this marker is getting so much attention in cardiology right now. Sign number 3, calcium buildup in the arteries. Now, this one is fascinating. Sometimes patients get a coronary calcium scan and discover plaque buildup even though their cholesterol wasn't terribly high. Think of calcium inside artery walls like rust inside old plumbing pipes. Once that process starts, blood flow becomes less efficient, and LPA seems particularly associated with accelerated plaque buildup and calcification, especially in the aortic valve. That's the valve controlling blood flow out of your heart. Over time, the valve can become stiff and narrowed. Imagine a door hinge getting crusted with rust until it barely opens. That's essentially what can happen. Symptoms might include shortness of breath, fatigue, chest tightness, dizziness with exertion. And many seniors assume, oh, I'm just getting older. I hear that phrase all day long, but aging alone doesn't explain everything. Sign number 4, stroke or mini stroke with no obvious explanation. Now, I don't want to scare you, but you need to know this. LPA has been linked to increased stroke risk because it promotes both plaque formation and clotting tendencies. A mini stroke, also called a TIA, may cause sudden weakness, speech difficulty, facial drooping, vision changes, or temporary confusion. Even if symptoms disappear after a few minutes, it is still a medical emergency. Do not sleep it off. I had a patient named George, 79 years old, who ignored temporary vision loss in one eye while watching television. He thought maybe he needed stronger glasses. 3 weeks later, he suffered a major stroke. Please don't gamble with neurological symptoms. Your brain is not something to wait and see about. Sign number 5, high cholesterol that refuses to improve enough. Some people take statins, improve their diet, lose weight, and still struggle with cardiovascular risk. Why? Because LDL cholesterol is only part of the picture. Think of cardiovascular disease like a house fire. Cholesterol may be the wood, inflammation may be the oxygen, blood pressure may be the wind, and LPA may be somebody secretly throwing gasoline onto the flames. You need to address all the contributors. Now, this next part is important because people always ask me, can I lower LPA naturally? The honest answer, not dramatically. Unlike ordinary cholesterol, LPA is largely genetic. Diet and exercise may help your overall cardiovascular health tremendously, but they usually don't reduce LPA very much. And I want to be truthful with you about that. However, you absolutely can lower your total risk. That's the key. If LPA is high, we focus aggressively on the things we can control: blood pressure, blood sugar, inflammation, exercise, weight, sleep, smoking, nutrition, stress, regular monitoring. It's about reducing the total burden on your arteries. Think of it like carrying heavy grocery bags. Maybe one bag is unavoidable, but if you can put down 6 other bags, your body handles the load much better. Now let's talk about practical things you can start doing today, because I never want people leaving my videos feeling helpless. First, walk every single day. I know, I sound like a broken record, but walking improves circulation, insulin sensitivity, blood pressure, inflammation, and vascular health, and you do not need marathon training. 20 to 30 minutes matters. Even 10 minutes after meals helps. One of my patients started with walking to the mailbox and back because severe arthritis made movement painful. 6 months later, she was walking around the park with her granddaughter. Small steps count. Second, prioritize protein and fiber. Most seniors don't eat enough protein. Muscles weaken, metabolism slows, blood sugar becomes less stable. Aim for protein with every meal: eggs, Greek yogurt, fish, beans, chicken, tofu, and fiber acts like a sponge inside your digestive system. Oats, lentils, berries, vegetables, flaxseed. These foods help improve cholesterol handling and reduce inflammation. Third, reduce ultra-processed foods. Now listen, I'm not asking you to live on kale and sadness, but packaged snack foods, sugary drinks, processed meats, and heavily refined carbohydrates can fuel inflammation. Your arteries like calm environments. Processed foods often create chaos. Fourth, strength training. This is the part nobody talks about enough for seniors. Muscle is protective. Muscle improves blood sugar regulation, improves balance, improves metabolism, improves vascular function. And no, you do not need to become a bodybuilder named Thunder Steve. Even resistance bands help. Chair squats, wall push-ups, light dumbbells, water aerobics. Start where you are. Fifth, sleep. Poor sleep increases stress hormones and inflammation, and many seniors have untreated sleep apnea without realizing it. If you snore loudly, wake up exhausted, or your spouse says you stop breathing at night, get evaluated. Sleep apnea dramatically increases cardiovascular risk. Now, let's talk medications for a moment because this gets confusing fast. Statins are commonly prescribed to lower LDL cholesterol, and while statins may not significantly lower LPA itself, they still reduce overall cardiovascular risk in many people. This is important. Some people online say, throw away all your medications. Please don't take medical advice from a man filming shirtless in a pickup truck while selling beef liver capsules. Medications have their place. The real goal is individualized care. Some patients benefit from statins, some benefit from PCSK9 inhibitors, some need blood pressure medications, some need diabetes treatment, some need all of the above. Medicine is not one size fits all, and exciting new therapies specifically targeting LPA are currently being studied right now. The field is changing rapidly. Now, I want to explain something incredibly important about inflammation, because this may be the hidden bridge connecting all of this. Imagine your arteries are smooth garden hoses. Inflammation acts like sandpaper scraping the inner lining. Once the lining becomes irritated, cholesterol particles, especially sticky LPA particles, are more likely to embed themselves in artery walls. That's why chronic inflammation matters so much. Sources of inflammation can include smoking, poor sleep, obesity, high blood sugar, chronic stress, sedentary lifestyle, poor diet, untreated gum disease. Yes, even gum disease. Your mouth is not Las Vegas. What happens there does not stay there. Bacteria and inflammation from unhealthy gums can affect the whole body. Brush, floss, see the dentist. Your cardiologist and dentist would both appreciate that. Now let me give you another patient story because this one really illustrates how sneaky this can be. Martin, age 68, retired mechanic, big personality, loved cheeseburgers and terrible jokes equally. Martin came in because of fatigue, no chest pain, no dramatic symptoms, just slowing down. He told me, "Doc, I'm getting old. My get up and go got up and left." but his stress test looked concerning. Further evaluation showed significant coronary artery disease, and yes, extremely high LPA. When I asked about family history, suddenly everything clicked. His brother died young from a heart attack. His father had bypass surgery. An uncle had a stroke. Nobody connected the dots. Martin eventually underwent treatment and made major lifestyle changes. 3 months later, he told me, "I thought aging meant decline was inevitable. Turns out my arteries were the problem." That distinction matters. Sometimes symptoms blamed on aging are actually warning signs. Now here are the red flags I never want you to ignore. Please listen carefully. Seek immediate medical attention if you develop chest pressure or pain, shortness of breath at rest, sudden weakness or numbness, facial drooping, trouble speaking, severe dizziness, fainting, one leg suddenly swelling, or crushing fatigue with exertion, especially if symptoms are new. And ladies, this matters for you too. Women often experience subtler heart symptoms, nausea, jaw pain, upper back discomfort, extreme fatigue, shortness of breath, not always dramatic chest pain. I've had women apologize for bothering us in the emergency room while actively having heart attacks. You are not a bother. Let me say that again. You are not a bother. Now I want to answer one of the most common questions. Who should get tested for LPA? Here's my general recommendation. You should strongly consider testing if you have a family history of early heart disease, you've had unexplained cardiovascular problems, your cholesterol seems okay, but plaque still developed, you've had stroke or heart attack without obvious explanation, or a close relative has high LPA. Many experts now believe everyone should have it checked at least once in adulthood, because again, it's largely genetic and usually stable throughout life. Now, before we finish, I want to give you a simple daily heart protection routine, 10 to 15 minutes total. Morning, drink water first thing. Take a short walk, even 5 minutes. Do 10 sit-to-stands from a chair. After meals, walk for 5 to 10 minutes. This helps blood sugar and circulation tremendously. Afternoon, eat a fiber-rich snack instead of processed sweets. An apple with nuts works beautifully. Evening, stretch your calves and hips. Practice slow breathing for 5 minutes. Aim for consistent sleep. And please keep up with regular checkups. Knowledge is power only if you use it. Because here's the hopeful truth. A high LPA number is not a death sentence. It is information, and information allows action. I've seen patients dramatically reduce their cardiovascular risk through consistent habits, proper treatment, careful monitoring, and early intervention. The earlier you know, the more options you have. That's the real message today. Not fear, awareness. There's a huge difference. And if you take nothing else from this video, remember this. Do not assume normal cholesterol means you know your full heart risk. Sometimes the most important clue is the number nobody tested. If this video helped you, give it a thumbs up and share it with someone you love. A spouse, a sibling, a friend, a neighbor, especially somebody with a family history of heart disease. And subscribe for more videos like this. I post every week and we talk about the health issues nobody explains clearly enough. Now I want to hear from you. Have you ever heard of LPA before today? Have you been tested? What surprised you most in this video? Leave me a comment below. I really do read them. I'm Dr. Amelia Carter. Take care of yourself, protect that heart of yours, and I'll see you in the next video.